Part 2, we will look at hospital types and different classifications. Hospitals are broadly divided into two groups. We have general hospitals that will provide many different types of services that will look into meeting the needs of the general population. Most hospitals that we have in the US healthcare system are general hospitals. We also have specialty hospitals that provide services in a specific disease or to a target population. These could be psychiatric units, a children's hospital, women's hospital, cardiac centers, cancer centers, rehabilitation centers, or even orthopedic hospitals. So the distinction here is a general hospital will serve all needs and they will serve a larger community based on the area, like a geographic region, whereas specialty hospitals try to be leaders in that particular field so that they would attract patients even from many different parts who would need that specialized treatment. There are many other classifications when it comes to hospitals and hospital systems. Let's use the next few slides to go through some of these classifications and see what are those different types. So hospitals could be standalone or single units, or they could be multi-unit operations. A single unit hospital would be just a hospital that works mainly by themselves. They serve the community that they are located in. A multi-unit hospital would be several hospitals, either regional hospitals or even in different cities in different parts of the country, but are being organized and being managed by the same management group. Multi-unit hospitals are sometimes the result of merging or acquiring of other hospitals that have financial problems. These could be all for-profit, non-profit, or even government-owned hospitals. The idea is to see how they can run these hospitals to be most cost efficient. A healthcare network is a group of hospitals. It could be a group of physicians, insurance, and even other service providers that work together to provide services to the community to see what are their overlapping goals, how can they collaborate and serve the community that they are present in. And there are many different community hospitals that work together in a network, and this tends to serve the patients better and try to help reduce cost of services that are provided. Hospitals can also be classified by the length of stay. Some hospitals focus on a short-term stay or acute care hospitals where patients would stay on an average less than 30 days. Many community hospitals are short-term hospitals. Then we also have long-term care hospitals where the focus is on patients who need care for an average more than 30 days. Examples include rehabilitation centers, treating patients with chronic diseases, and treating even patients who have a long period of recovery. So these hospitals are geared towards catering those patients. A majority of the hospitals would fall under the acute or short-term hospitals. Hospitals can also be classified in the area or where they are located. They could be rural hospitals, urban hospitals. There are many more urban hospitals, and it makes sense because most of the population is gathered in urban areas, so they need more services and more hospitals serve this population. Rural communities have hospitals that tend to see more and more poor and elderly patients, and they also sometimes tend to have certain financial problems. But this is something that the government has recognized and put certain measures to make sure that these communities are also served. So, due to financial issues that can arise in rural hospitals, Even Medicaid has a certain program that tends to help these hospitals to try to make sure that they are still operational and serving those communities. They have also been classified as critical access hospitals, where they need to have a certain number of beds, need to be able to serve certain types of patients, provide emergency care, and government tends to support these programs to make sure there is equality or equity and ability to have equal access to healthcare, whatever the region or location is. Then hospitals also can be teaching hospitals. These are the hospitals that help um, uh, physicians who are in training or even residents to try to work in a certain institute to work towards their license in that field. These teaching hospitals tend to be in medical centers where there would be hospitals, organizations that surround a medical school. So there would be teaching faculty, medical students, and residents in that community serving that population. And there are about 400 teaching hospitals that are members of the Council of Teaching Hospital and Healthcare System in the United States and Canada. There are also some other hospitals that are known as safety net hospitals. These are mainly provided by charity organizations that receive payments from sponsors in their community, maybe even some government support, because most of the service that they provide will likely be uncompensated care. So, looking at patients who might not qualify for health insurance, not qualify for a government provided health insurance like Medicaid, Medicare, and see how can we serve these populations, and that will be the safety net hospitals. Then there are also some hospitals, church related hospitals, and these have been developed in a way that they can incorporate spiritual work and aspect of missions and caring for their community. So now let's take just a little bit of a time to discuss hospital governance. How does a hospital system run? Who's in charge in terms of making financial decisions, making policy decisions associated with the hospital? Hospitals are governed by a chief executive officer, a CEO, and a board of trustees or a board of directors. And there has to be a chief of medical staff. So there has to be individuals who would see the business side of aspects of the hospital and someone who sees the medical side of the aspects. So all these together with connections to the board of trustees, their responsibility to make sure that the hospital is operational, there is good financial health, and that they are serving the mission and the vision of their organization. For hospitals to be able to provide services at a higher standard, or to make sure that the hospital service provided meets at least a minimum standard, hospital accreditation is important. This is usually done at the state level, so there will be different requirements from state to state in terms of hospitals, in terms of licensure of medical practitioners, and these are also overseen by the Joint Commission that will try to have a baseline or a standardization of all the services that are provided association with hospitals. This is important because to be able to utilize government funding through Medicaid, through Medicare, and have reimbursement, hospitals need to meet these accreditation requirements. That is a good thing because then we know that they at least have the quality of care that is provided meets the national standards. To help improve the quality of care, there are certain processes that are in place. So the Institute of Medicine has defined a quality of healthcare as having 6 dimensions. These are different pieces of the puzzle that works together to try to make sure that there is patient-centered healthcare and to provide the highest quality of care possible. So these aspects include um, safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. So all these things come together, and this provides a framework where the quality of care can be continually assessed and improved. So if you look at these different categories, safety comes with do not do any harm to your patients. Effectiveness comes with looking at what is the available evidence-based data that is there. Are we using the best data, best practices that are backed by evidence? Patient-centeredness looks at how can you look at the patient's need to be respectful, to provide what is valid for the patient. Timeliness, meaning to not have much wait times, don't do harms by delaying, and provide the services as soon as possible. Effectiveness is to cut costs, to eliminate waste, and use what you have in the best possible way. And equitability looks at providing the same quality of cares to all individuals, to all patients, irrespective of gender, ethnicity, geographic location, or the socioeconomic status. So in order to improve the quality, there are certain standards, there are certain processes, or even certain organizations that help collect data and allow the use of this data to try to help better decision making. So there is a process or an organization, Lean Six Sigma. They use an approach where they are collecting statistics constantly from patient care, and these statistics are going to be used in making decision making to help promote efficient use of the resources they have. And there is also this framework called Plan, Do, Study, and Act. So this is a framework that was developed by the Institute of Healthcare Improvement. This is a 4-step cycle that helps to focus on improving the workflow. How are things being connected? Is there um, easy transition, or how the function of the hospital happens is looked through this. So through this plan, do, study, act process, there will be always a cyclical process. Okay, what are the objectives? What are the main goals that needs to be happen? And come up with a certain plan of, okay, these are the things that we need to know to meet these. And how are you going to carry them out? And then study or assess the situation to make sure that the goals are being met and see how that could be further improved. And I also mentioned that the Joint Commission is involved in accreditation, making sure the quality of services are met. So large hospitals work with the Joint Commission to make sure that they meet the safety and quality patient care. And the plan do the PDSA process is used in this process to help determine what areas need to be improved to provide the best possible quality care. And to be there are certain agencies that look at hospitals to see how well they are doing, how well they are handling patients, and what type of quality of service that they're providing. The Leapfrog Group is one of these organizations that does annual hospital surveys. So they look at various benchmarks that are required to provide quality service, and they will have a hospital safety score, and they will also come up with a letter grade for safety rating. And these are important, used by different employers when they are looking at different hospitals for their use, and they are also looked at or looked by insurance companies when they are trying to partner with these hospitals to provide these services. Next part, we will look at outpatient services.